ratios, patient ratios. Will I be floating to other units? And if so, which ones? What are the shift times? Am I required to work certain holidays during my contract? Those are really common ones that we find. And just also, hey, why do you have travelers? What's the need? Why do you have the need to have travelers? And a lot of times they kind of already know that answer. Maybe it's in a critical access hospital out in the middle of nowhere. There's just not a lot of labor force around there. And so those are things that we like to prepare people for in terms of questions. Also, a lot of times they'll ask questions about the pay, right? And since we're the employer, they don't necessarily just disclose that information because they don't know, right? So we always tell folks, hey, the pay side of things, the benefit side of things, those all come to us, specific to the hospital, specific to the unit. You definitely want to make sure you understand where you're working, who you're working for, right? So that you're most well prepared to understand, hey, if I get an offer, I understand where I'm going to go with this. It's going to be a yes or a no. So a lot of times when they are on the phone with a manager, these are folks that are working the unit every day. Could be a director as well. They know their units very well, and so they know who's going to succeed and who's not most likely to succeed. So be prepared to really dig into the questions they ask you. They may ask you very specific questions about your experience with, trachs or vents or IVs, things like that. So be prepared to answer those questions and do it in a manner that makes sense, right? I mean, don't get disengaged with them. They're really trying to make sure that you're the right person for the opportunity and that you're going to succeed as well. They live in the community, they care about the communities they work in, and they want to make sure they give the best possible patient care. So they also want to make sure that, hey, even though you've got 15 years experience, you may just not be the right fit for their unit. And that's okay. We'll find the right opportunity.